I'd like to talk to you about my approach to the patient for marking with the RoboMarker. So I think one of the key things is to introduce yourself, make sure the patient knows who they're talking to because they've got a lot of people coming in the room. Always give them an extra numbing drop because it's common for the numbing medicine to wear off a bit before you get there, and make sure they're numb. You have to sit them up because it is a pendular marker. It only works when it's in the horizontal position. So after you've introduced yourself and they're sitting up, and also make sure their head position is not tilted. You want their head to be pretty much in the position it was when they had the corneal topography done. So their head's up, stable, looking ahead, and then it's common for me to ask them to cover the eye that we're not going to be marking. That way, if it's a dominant eye, it's not combating the eye that's getting marked. At that time, I'll tell them that we're going to mark their eye. It's going to be very comfortable. They won't feel anything more than just maybe a little pressure. The sterile disposable tip is in a wrap. We click the RoboMarker twice to get it to turn on. That's required so it doesn't turn on when it's in your pocket. You have a choice of white light. I tend to prefer the blinking red because I can time how long I'm on the cornea. It also has color changing, which some of the patients from the 60s and 70s really enjoy. So we apply the tip. We adjust the axis arrow to the proper degree that we're going to use. Let's say we're going to have a toric at 120 degrees. Adjust that axis to 120 on the dial, pull off the top, and now no matter how I turn the handle, it's always going to maintain 120 degrees. So now it's time to actually apply it to the patient's eye. It's perfectly normal as you get close to feel a little uncertainty. So sometimes I will brace one of my fingers against their nose or against their cheek to stabilize the RoboMarker at that point, because you really want it to land right in the middle of the cornea. If you go a little bit high or a little bit low, the marks will be parallel to where you want them, but the doctor will have to make some adjustments at the time of surgery. Finally, you apply the tip to the cornea. I usually hold it there for 1 or 2 seconds and then release. And I try to keep the eyelids open for about another 5 to 10 seconds to let that ink really soak into solution, enter the epithelium, and become more permanent. We don't want the patient just to start blinking because they'll blink the ink off, or they'll blink the ink around the eye. It's really important that you don't hold the tip on the eye too long, just like you wouldn't want to hold a Jensen violet marker on the eye for 30 seconds. It would leave too much ink and you'll cause a chemical keratitis. So we're looking at about 1 to 2 seconds and then release. So one other fine point is if the tips do not touch the cornea at the same time, there's a small chance that they could rotate. One way to prevent that, if you have a patient that's a little bit nervous, is a little prone to movement, right before you land on the cornea, you do something called the finger break. And I want you to pay attention to this finger, because right before we land, I just rest my finger on the axis dial. That prevents it from moving. So if the patient were to move right as I touch down, or if I were just coming in at an angle and I wasn't touching down with both tips at the same time, the finger break will prevent the movement of the dial. You want to be careful that you don't put the finger break off to the side, because then you could actually move. So it's really a on top motion, so you don't move the axis from its current position. So finger break, land on the cornea, and that will give you a little bit extra stability. So these are the basic tips for using the RoboTip. If you have any questions, we certainly look forward to that. You can email us or call us at SurgeonLoom.